Well, hello and welcome. This is the Healthcare Accountability Ordinance HCAO Minimum Standards Review webinar. This is hosted by the Office of Labor Standards Enforcement and the Department of Public Health. We welcome you. A little bit of housekeeping and admin stuff before we get started. The slide deck and a recording of this webinar will be posted on our website. I'm also going to drop a URL in the chat box. So if you don't have your chat box open, feel free to open that up and you will see a URL that's a little bit different from this one on the screen where our video will land. More about the chat box. We're going to share some important information in there, like URLs, contact information. Unfortunately, we won't be able to chat with you during the webinar. It's just Max and myself today, but we're going to go through how you can send us questions and get answers. How you can do that is by opening up your questions and answers box on the right-hand side. We are going to have a live question and answer session at the end of the presentation, and we will select questions to answer live during that time. Now, if your question is not selected during that session, staff will contact you directly with a response. And the email address we are going to use to respond to your question and provide answers, it will be the email address you use to register for this webinar. Now, if that's not the email address you want us to reply to, please put that information into your question, as well as any phone numbers. Maybe it's a phone call that we need to just reach out to. So my name is Beverly Popek. I'm with the Office of Labor Standards Enforcement. I will be presenting on some general HCAO compliance information. And with me, I have my colleague, Max Gara from the Department of Public Health. Max will be presenting on the HCAO minimum standards. So before we dive into the minimum standards, it's important to understand some general HCAO compliance information. The Office of Labor Standards Enforcement enforces and administers the Healthcare Accountability Ordinance. If you have questions regarding eligibility, compliance options, how this pertains to your particular contract requirements, you would contact us, the Office of Labor Standards Enforcement. Now, we do have quite a few employers, and it looks like brokers who represent employers at the San Francisco International Airport, also known as SFO. So I'm going to spend a minute or so speaking directly to these employers at SFO. The Healthcare Accountability Ordinance, the minimum standards that you're hearing today, what we're talking about right now in this webinar, is applicable to all employees who are not Quality Standards Program, QSP employees. So you're going to need to know this to comply with the requirements. And if you're not exactly sure, if this is the first time you've heard this, you should contact the Quality Standards Program unit at the San Francisco International Airport. This is the contact information, and what I'm going to do is I'm also going to drop it into the chat box so you can have this information to contact them at a later date if needed. Now, with that said, I'm going to give you some examples of HCAO covered employees at SFO. And these are just examples. So the first example I have at the airport would be food and retail concessionaire workers. If there is a collective bargaining agreement, a CBA, with a union, take a look to see if your CBA has a waiver. But food and retail concessionaire workers are covered under the Healthcare Accountability Ordinance. Some more general positions that are covered under the Healthcare Accountability Ordinance would be folks who provide professional services such as architects, engineers, planners, administrators, people who work in the office. So that's some general information. So moving right along to the healthcare accountability ordinance, to understand if this is relevant to you or perhaps a client you're representing, you have to understand whether or not the employer is covered under the healthcare accountability ordinance. So the first item you should keep in mind is the employer should have at least 20 or more employees, workers anywhere in the world. It is a global count. It's not contract specific or how many employees does the employer have in San Francisco or something like that. So that's the first item. The next particular requirement or item to see if someone is a covered employer is that the employer must have some sort of city contract. Now, that's a very broad term. Let's unpack it a little. A contract, perhaps it could be an agreement to provide services for a specific department with the city and county of San Francisco. And we're a large city. We hire a lot of companies to provide lots of things, and that could be you. We've also mentioned the airport. We also have leases at the airport. We have contracts at the airport. We have leases at the port. We have leases with quite a number of our departments. So perhaps you have something like that. And there could be other types of contracts in which this requirement, the healthcare accountability ordinance requirement, is a provision in your contract. Now that you understand who is a covered employer, let's move over to understanding who are covered employees. Covered employees, it's anyone who works at least 20 hours a week or more on the contract. So you have to know what the contract really is to understand who these covered employees are. So for example, um, if you have a lease, it's super easy because it's pretty much folks who just work on the leased property. If it's a specific contract to provide services such as consulting services or photography or outreach, well, it would be the employees who work at least 20 hours a week performing those services for that contract. It's not anyone and everyone in your company. Now, there are some things to keep in mind. If a worker is covered if they're performing work anywhere in the United States. So as we have technology, you're joining us by WebEx over the internet from who knows where in the world and parts of the country. We have a lot of companies and employees performing work for our city elsewhere in the United States, not here in San Francisco, California. So remember that if the worker is performing services for us, they are covered if they're performing that work in the United States. Fluctuating work hours. We get this question a lot. If the average number of hours per week during an applicable month are 20 hours or more, then the employee is covered under the HCAO. If you have a specific question whether or not employees are covered, and that is really a big factor and part of your question, let us know, and we should definitely set up a time to discuss. Compliance options. There are 3 options to comply with the Healthcare Accountability Ordinance. The great news is that the employer chooses which option or options they would like to employ to comply with these requirements. Now, for today, we're only going to review option 1, as option 1 really is specific to the HCAO minimum standards in which the employer has chosen or decided to offer a compliant health plan. So let me pop in here into the chat box a URL with the HCAO poster with the 3 different options, and you can review that at a later date. Now, this is option 1. This is offering a covered employee a compliant health plan. And this health plan has to be at no charge to the employee. There's no deduction from the employee's paycheck. And in terms of eligibility, when does this start? When does an employer have to comply with the Healthcare Accountability Ordinance? It's no later than the first of the month after 30 days. Now, a compliant health plan must meet all of the HCO minimum standards, and Max is going to really take us into those requirements very, very soon. Few more compliance requirements for all of these things. We have new posters and forms. That's an annual requirement every July 1st. We are on a fiscal year calendar. So every July 1st, we have updates. We have on-demand webinars on our website. We have lots and lots of information on our webpage. And if there's something you're looking for that you can't find, just reach out to us and let us know. We also have a voluntary compliance program where we offer employers who are not in an active investigation already the ability to come to us and figure out if you owe anything to workers. Maybe there's something that you're reviewing here and you would like to discuss it with us. Please don't hesitate. Let's be proactive in figuring this out and mitigating any violations. If there are any HCAO fees owed, we will discount the fees by 50%. And OLSC will not charge any penalties if you participate in this program. So if this is something that you're interested in, please contact us. Now, this is the contact information for the Healthcare Accountability Ordinance unit with the Office of Labor Standards Information in Enforcement. I'm going to pop this into our chat box so that you can have that. And lastly, I'm going to remind you that send your questions to us in the questions box. We're going to select questions to answer during the live question and answer session at the end of Max's presentation. And if your question is not selected for an answer live, staff will contact you directly with a response at the email address you use to register for this webinar. So I'm going to hand this off to my colleague, Max. Hello, Max.
Hi, Beverly. Can you hear me? Wonderful.
Yes, I can.
All right. Thank you, Beverly. So my name is Max Guerra, and I work with the Department of Public Health's Office of Policy and Planning, and I'm the department's lead on the HCAO. Next slide, please. So enacted in 2001, the Healthcare Accountability Ordinance, or HCAO, represents one of San Francisco's early pioneering efforts to reduce the number of uninsured in San Francisco. The purpose of the HCAO is to increase the number of San Francisco workers that have access to affordable health insurance. The law requires that employers with a contract with San Francisco or leases San Francisco properties provides a health insurance plan that meets a set of minimum standards. The employer pays a fee when they choose not to offer a compliant plan, and this fee is intended to cover the cost of health care provided to those uninsured employees that may seek healthcare services within the San Francisco Health Network, which is the safety net healthcare service program run by the Department of Public Health. A health plan that is offered, again, must meet all minimum standards to be considered compliant. The law requires that these standards are reviewed every 2 years, and the Department of Public Health forms a work group that reviews the standards to propose recommendations on revisions. And the Health Commission has the sole authority to revise these standards. The standards were recently revised in July through the work group process I just went through, and the revisions will be going into effect starting January 2025. One point of clarification that I want to note is that the HCAO is distinct from the Healthy Airport Ordinance, or HAO, like Beverly mentioned. And again, as Beverly mentioned, the HCAO, under the HAO, employers at SFO with employees covered under the SFO Quality Standards Program, or QSP, are required to meet a different set of health coverage requirements that are distinct from the HCAO. And again, if you have questions about whether or not your employers are covered under or employees are covered under the SFO QSP program, you can contact that program directly. Next slide, please. So again, before diving into the updated minimum standards, um, I want to discuss the relationship that the Office of Labor Standards and Enforcement, or OLSC, and DPH each have with enforcing the HCAO, and how you may interact with these agencies regarding your compliance with the law. So as that diagram shows, DPH facilitates the process to update the minimum standards and reviews health plans for compliance. OLSE is more focused on enforcement and engages in actions like responding to worker complaints and auditing employers. If you have questions about how the current or potential or how a current or potential health care plan complies with the standards, you can send them to me as DPH's representative, and I'll have my information listed at the end of these slides. Next slide, please. So let's move on to the minimum standards. Plans only need to cover individual medical coverage for the employee only, and the standards do not apply to vision or dental services. There are 16 standards, and overall, the standards break into 3 types. Premium contributions, which must be fully paid by the employer. Cost sharing, which includes out-of-pocket expenses, deductibles, copays, and coinsurance. And required covered services, which align with the essential health benefit categories. Before diving into more details into these standards, I do want to preface that if you're working with an insurance broker, they can send me questions about whether plans being considered comply with the minimum standards. Next slide, please. So at this time, I'd like to review the actual minimum standards that will be going into effect January 1st, 2025, and how they differ from the current minimum standards. So first, as is currently the case, all gold and platinum plans are automatically deemed compliant if the employer covers 100% of both the plan premium and medical services deductible, and the plan covers all required covered services standards. Note that if your plan, your health insurance policy does not end until after the revised minimum standards become effective for 2025, they will not be considered out of compliance. Only the subsequent plan with an effective date on or after January 1st, 2025 will need to comply with the revised standards. Next slide, please. So for standard 1, there is no change. And again, the employer must still pay 100% of the plan premium. For standard number 2, which focuses on the out-of-pocket expenses, this remains similar to the current standard. So under the standard, employers must still cover the employee in-network out-of-pocket medical expenses up to 50% of the plan's out-of-pocket maximum. So what does this mean? So for example, if a plan's out-of-pocket maximum is $8,000 for in-network expenses, then the employer must cover the initial $4,000 of expenses that count towards the out-of-pocket maximum. These expenses must be covered on a first dollar basis, and all types of cost sharing, including deductibles, copays, coinsurance, must count towards the out-of-pocket maximum. Employers may use any health savings or reimbursement product that supports compliance with this standard. And lastly, the out-of-pocket maximum has been changed to be synced with the federal out-of-pocket limit for a self-only coverage plan instead of the patient-centered benefit design plan. So in 2025, what this means is the limit will be raised to $9,200. Next slide, please. So I want to briefly talk through options for complying with the out-of-pocket standard. First, employers are encouraged to discuss the optimal reimbursement mechanism with their benefits administrator. Employers may use any third-party administrator or other appropriate option to manage reimbursement of an employee's medical expenditures that count towards the in-network out-of-pocket expenses as long as the employee's protected health information remains private and confidential in accordance with state and federal law. Reimbursement options can include an HRA or HSA, and there's no need to pre-fund the full required amount. And while not required, employers are strongly encouraged to provide an employer-funded mechanism to beneficiaries, such as a pre-funded debit card to cover out-of-pocket expenses upfront. Next slide, please. So for the standard on medical services deductible, the deductible limit will remain set at $3,000. And for Platinum or Gold plans to be automatically compliant, employers must still fully cover the deductible, as I mentioned earlier. Under Standard 4, plans must provide drug coverage, including coverage of brand name drugs. And if a prescription drug deductible is required, it cannot exceed $400 for in-network drugs, and this is an increase from the previous standard of $300. Next slide, please. The next standards are focused on cost on coinsurance and primary care copayments, both of which have been adjusted to increase the availability of silver plans for employers to choose from. If coinsurance is required for any service, they cannot exceed the following breakdowns. For in-network services, 55% of expenses must be covered by the plan, and 45% must be covered by the employee, which is a change from the previous standard of 60% being covered by the plan and 40% by the employee. For out-of-network services, costs are split evenly. Primary care provider visits must be covered, and if a copayment is required, then in-network costs cannot exceed $65 per visit, and this is up from $60 per visit. If coinsurance is provided instead, which is allowed, then it cannot be greater than the coinsurance standard I just went through. Next slide, please. For the rest of the standards, there are no changes, but I'll still go through and review them. Preventative and wellness services must be provided at no cost, and this is in following with the Affordable Care Act rules. For pre- and postnatal care, scheduled prenatal exams, and first postpartum follow-up consults, these must be covered without charge, and again, this is in following with the ACA rules. Next slide, please. Plans must cover ambulatory patient services, and the coinsurance requirement I just mentioned apply. And if there are co-payment services, they must not exceed limits related to primary care provider visit requirements. Hospitalization must be covered, and if coinsurance is applied, they must follow the coinsurance breakdowns I've described. Next slide, please. Plans must provide coverage of behavioral health services, rehabilitative and habilitative services, and laboratory services. No co-payment requirements are specified, but the same coinsurance requirements apply. Next slide, please. So the last standard requires that the plans cover all benefits listed in the California benchmark plan. This standard is especially pertinent for employers that are based outside of California. Other states may not require coverage of services that are required in California, such as bariatric surgery or acupuncture and weight loss services. It's not uncommon for out-of-state employers' plans to be deemed non-compliant as a result, even if cost sharing is compliant. And this same principle applies to large employers that have more flexibility in their plans. So please make sure that your plans are offering all the services that are in the Essential Health Benefit Plan for California. Next slide, please. So again, remember that compliance is all or nothing, and all standards must be met for a plan to be considered compliant. An employer plan is compliant with the minimum standards if it is a bronze or silver plan that satisfies all minimum standards that I just went through, 1 through 16, or if it's a gold or platinum health plan where the employer covers 100% of both the plan premium and medical services deductible, And the plan covers all required covered services. And this is in reference to minimum standards number 5 and 8 through 16. And lastly, I want to reiterate that the HCAO is again distinct from the Healthy Airport Ordinance. Under the HCAO, employers within employees covered under the SFO QSP program are required to meet a different set of health coverage requirements that are distinct from the HCAO. Next slide, please. So if you have any questions or if you'd like someone to review your plan to see if they comply with the law, please don't hesitate to reach out. And my contact information, both email and phone number, are on this slide. And I believe Beverly just plopped it into the chat box. Thank you.
Yes, I did. So check the chat box. We have Max's contact information in there. And this leads us to our question and answer session. So if you haven't already, send us your questions in the questions box. We will select questions to answer. And if your question is not selected for an answer right now in the live session, we will contact you directly with a response. We're going to contact you at the email address you used to register for WebEx, this WebEx webinar. If there is other contact information that you'd like us to use, please put that into the questions box. So let's see here. Max, while you were presenting, I have a couple questions on this one, and the question that I have here is, does the HCAO require that coverage be offered for the individual employee and their dependents?
Yeah, I think this is a common point of confusion. So no, the HCO only requires that medical insurance be offered to the individual worker, not to their dependents.
Okay, let's see here. Um, Next question. If our health insurance policy does not end until after the revised minimum standards become effective for 2025, will we be considered out of compliance?
Yeah. This is a good question. Thanks, Beverly. And this is something that comes up every time we change the standards every 2 years. So an employer's plan that overlaps with the revised standards that are going into effect January 1st, 2025, they're still under the standards that are effective from the previous year, those that were in effect January 1st, 2024. But any subsequent contract that's effective on or after January 1st, 2025 will need to comply with the revised or updated standards.
Okay, thank you for that. Yeah, it's we're on a fiscal year, but the standards are effective January 1st, and that's good to know. This particular question has to do about, I guess, the differences or if someone has to comply with the HCAO or HAO, which is the Healthy Airport Ordinance at the airport. How do I know if I have to comply with the HCAO or HAO?
Yeah, I know Beverly, you went over this and I kind of spoke to this a little bit, but again, the HAO applies to employers at SFO with employees that are covered under the SFO's Quality Standards Program or QSP program. And again, these employers are required to meet a different set of health coverage requirements that, again, are distinct from the HCAO. But if you have any points of confusion about whether or not you fall under the QSP program, you can reach out directly to that program. I think there was a phone number listed, or you can reach them via email. And their phone number, I believe, is 650-821-1103, or their email is qsp@flysfo.com.
And I put the contact information for the Quality Standards Program in the chat box, folks. I think it gets super important to understand who are Quality Standards Program employees and non quality standards program employees. And if you don't know this, contact the QSP unit at the airport. And folks, this is just for people at the airport to find out. And I'm not kidding, but you might have to make a little chart in the beginning to just get organized. And with that, if you need specific compliance information regarding options for HCAO and HAO and how they interact and well, they don't, um, give us a call or drop us an email at OLSC and we can work with you on understanding this. But really, the Healthy Airport Ordinance is completely different from HCAO. Let's see here. Let me pick up this other question here. This employer is asking, since an employer has only has to offer one compliant plan, do other additional plans have to follow the same rules? I guess this is about buy-ups and the ability to offer more health plans beyond, I guess, the HCO compliant one.
Yeah, yeah. Yeah, we see employers offer numerous plans to their employees based on right the composition of their employee population. But an uncovered employer only is required to offer one compliant plan at no charge to the employee that meets the minimum standards that I went through. If they do choose to offer additional plans, these plans don't need to meet all the minimum standards and they can be administered as the employer so chooses. So, for example, after offering one compliant plan at no charge, the employer can provide a plan that might not cover all required covered services under the minimum standards, or they can offer a plan that has an employee contribution requirement for the plan premium.
And if that's something that you're doing, check in with OLSC to understand what are the compliant documents required to capture that you as an employer offered a compliant health plan first. And then if you have buy-up options, it's super clear that the employee has opted out saying no, thank you. And we do have an HCO voluntary waiver form on the OLSC website to capture that, and then you can do your buy-up process. Um, okay, so then this one is a common question about companies who have health plans that are written out of state. This person writes, if our plan is written out of another state, what can we do to comply with the coverage requirements under standard number 16, I guess regarding this California benchmark plan?
Yeah, yeah, yeah. And as you mentioned, Beverly, right? A lot of contractors that the city contracts with are out-of-state organizations. And what we see in terms of employers complying with the minimum standards is that if they have a plan that's written out of state that maybe doesn't provide all the covered services in the essential health benefit plan, for example, like bariatric surgery or a weight loss program, we'll see companies get a rider for the services that their plan currently doesn't offer. Or if it's just too difficult or cumbersome, they'll just get a plan that's written in California, which are required to follow all or provide all covered services in the California Essential Benefit Health Benefit Plan.
Yeah, I think with our work, Max, we see companies that try to stay with their plan that's written out of state. And as you said, if the rider doesn't work or it's not possible or for whatever reason, maybe cost, maybe just difficult, too difficult under the contract with the insurance company, we do have a lot of companies who are able to obtain health insurance here in Northern California specific for these employees in California or Northern California. And it works out, and we do have options. So I think, let's see, this one is about weight loss drugs. Um, so Max's question is about weight loss drugs. Must they be covered by the HCO compliant plan?
Yeah. I'm getting this question a lot more, especially with these new novel weight loss drugs that are coming onto the market. Under the HCO's minimum standard, number 16, right, the requirement that a plan has to cover all services and benefits on the California Essential Health Benefit Plan. Um, the compliant plan has to cover all the services and prescription drugs that are listed on the California Essential Health Benefit Plan. And so this plan actually specifies which pharmaceuticals or prescription drugs must be covered. And it provides a list of the categories and classes of drugs in a table. Uh, and so as long as the plan matches those requirements, the plan would be compliant. So it doesn't specify specific drugs, but just classes and categories of prescription drugs that have to be covered. One other kind of parallel question we get is kind of weight loss programs and what constitutes a weight loss program, because that's a required service that needs to be covered under the California Essential Health Benefit Plan. And so these usually refer to behavioral interventions, and this is kind of aligned with the U.S. Preventative Services Task Force recommendations on these types of recommendations. And so usually where they're not constituting prescription drugs, but more behavioral health interventions, and usually at the discretion of what the provider recommends.
Thanks for that. And I think when employers or insurance brokers ask about this number 16, I mean, number 16 refers to the California, benchmark plan, and those are state standards that the HCO minimum standards just have as number 16. And there's a lot of information on that is online. So number 16 is a pretty big standard, especially if your health plan is not written in the state of California. Um, okay, so we have a question about pediatric vision and dental, um, because I guess that's part of the California benchmark plan. Do we have to offer pediatric vision and dental?
Yeah. As you mentioned, Beverly, even though this is a required coverage requirement in the California Essential Health Benefit Plan, we don't expect coverage of this service because usually the covered employee is just an adult. So we won't ding a plan if they don't provide coverage of pediatric vision or dental coverage.
That's right. And for most of the folks here that are under, this is a contractual or a contract requirement, the HCO is, you're going to be hiring adults over 18. Um, so that's something to keep in mind. Oh, okay. This is a good question. This has to do with paying the HCO fee, which is option number 2. Um, this person writes, if we pay the HCO fee instead of offering a compliant plan, does that count as insurance or does the employee benefit directly from those payments? And what I'll also do is when Max is answering this, I'm just going to put in the poster um, URL so you could see the 3 options. So that's the question, Max. I don't know if you
Yeah.
needed me to repeat
No,
that
no,
one.
no. So yeah, as you mentioned, that's in reference to option two, and the fee does not count as insurance for the employee or count as providing insurance to the employee. And in most cases, this fee does not go directly to benefit the employee. Rather, it goes to the Department of Public Health to run its health coverage program for providing services to uninsured in San Francisco. There are a couple like edge cases of circumstances where if an employer does pay the fee, it does go to the employee. But as Beverly mentioned, I believe those are outlined on the poster in terms of where the fee is directed.
Yeah, Max, you're talking about option three, and specifically if that option's available to you as the employer to choose really depends on where your employee is performing the work. So option two and three is specific to where work is being performed in the United States. Option one, which is offering a compliant health plan, is available anywhere in the United States. So I did put that URL in there to our poster. I think the poster is pretty straightforward. It's direct. But if you have any questions, you can reach out to us, OLSC, about the different options. And then just following up on option two, if you're paying the fee or planning to pay the fee, we have the payment form on the OLSC HCO webpage. Since we are on the fiscal year, the rate increases every July 1st, and payments are due the 15th after the first of the month. So where are we? We're in September. So say you had work performed in August and you want to pay the fee, you should start working on figuring out how much you owe in HCO fees, and paid by the 15th of September, using the contact information on the payment form. And the fee money is not a direct benefit to your employees. The report or the fee payment form will ask for information about who are your employees, and that those funds are used to run the programs that Max mentioned. So kind of wrapping it up here, I think all of the other questions we're going to have to take offline and contact you all directly. But this is a last one for you, Max. Does it matter if our plan is self-funded versus fully funded as it relates to the minimum standards you just went through?
Um, no, it really doesn't matter if the plan is self-funded or fully funded, as long as the plan complies with the minimum standards that we went through in this presentation, then the plan would be compliant with the ordinance.
All right, that's great. So there aren't any exemptions or waivers if you have a self-funded plan. We get that question a lot. So thank you for attending our webinar. A copy of the slides and recording will be available on our website in the next day or so. And if you need some specific assistance, don't hesitate to reach out directly to Max or myself. And I hope you all have a great day. Thank you. Take care.
Thank you.